A surgeon in ancient Peru drilled a hole into a living patient's skull with a stone tool, and that patient survived, healed, and lived for years afterward. We know this because the bone grew back. That is not mythology. That is archaeology. And it is just the beginning. Fact number 1. Prehistoric skull surgery had a higher survival rate than Civil War amputation. Let that sink in for a second. The procedure is called trepanation, drilling or scraping a hole into the human skull, and it is the oldest known surgical operation on Earth. Archaeologists have found trepanned skulls dating back over 9,000 years on every inhabited continent. But here is the part that makes modern surgeons stop and stare. In a study published in the journal World Neurosurgery in 2018, researchers examined 59 trepanned skulls from pre-Columbian Peru, dating between 400 BCE and 200 CE. They found that between 70 and 90% of patients survived the operation. How do we know? Because bone regrowth around the hole proves the patient lived weeks, months, or even years after surgery. Now compare that to the American Civil War, roughly 1,800 years later, where leg amputations, far simpler operations, carried mortality rates of around 26 to 33% due to infection alone. Ancient Peruvian brain surgeons, working with obsidian blades and no germ theory whatsoever, were statistically safer than 19th-century American military surgeons. The reason, researchers believe, is technique. Peruvian surgeons learned through practice that scraping the bone slowly, rather than drilling through it, minimized damage to the underlying membrane. They figured out surgical best practice through pure empirical observation, thousands of years before the scientific method existed. Visual note: display a color-coded diagram of trepanation bone regrowth stages, alongside a simple bar chart comparing survival rates across eras, no graphic imagery. Fact number 2. Ancient Egyptians used a bread mold antibiotic 3,500 years before penicillin. In 1928, Alexander Fleming accidentally discovered that the mold Penicillium notatum killed bacteria, and the world called it a revolution. But here's what the history books often skip: Egyptian medical papyri dating to approximately 1550 BCE, the Ebers Papyrus and the Edwin Smith Papyrus, explicitly prescribe applying moldy bread directly to infected wounds. The instruction is specific: use bread that has gone green and apply it as a poultice to suppress infection and reduce swelling. For a very long time, historians assumed this was superstitious folk medicine. Then, in the 1990s, a team of researchers including Dr. Yaroslav Ryzansky began analyzing ancient Egyptian and Sudanese skeletal remains and found tetracycline, a powerful broad-spectrum antibiotic, actually incorporated into the bone matrix of people who lived between 350 and 550 CE. The antibiotic had been consumed so regularly and in such quantities that it physically embedded in their bones. The source? Fermented grain and stored cereals contaminated with Streptomyces bacteria, which naturally produce tetracycline. These people were not accidentally eating antibiotic-laced food. Evidence suggests it was deliberate. Ancient Egyptians and Nubians were effectively running a low-grade antibiotic therapy program at a population level, 1,500 years before anyone isolated a single antibiotic molecule in a laboratory. Visual note: show a split infographic, left side, ancient Egyptian papyrus text excerpt translated into English with the bread mold prescription highlighted, right side, a clean molecular diagram of tetracycline structure. Fact number 3. Viking surgeons diagnosed internal abdominal injuries with a soup. This one sounds absolutely absurd until you understand the biochemistry behind it, and then it becomes one of the most elegant diagnostic tools in medical history. Norse and medieval Scandinavian battlefield surgeons, based on accounts corroborated by the Old Norse medical text Konungs Skuggsja and archaeological evidence, gave wounded warriors what researchers now call a leek soup or onion broth. The patient drank the pungent broth. Then the surgeons waited. Then they leaned in close and smelled the wound. If the wound smelled like onions or leeks, the diagnosis was a perforated gut, a penetrating abdominal injury that had opened the digestive tract. If there was no smell, the intestines were likely intact. This is genuinely brilliant medicine. When the digestive tract is punctured, its contents, including volatile sulfur compounds from foods like onions and leeks, leak into the abdominal cavity and diffuse outward through the wound site. The surgeons had no knowledge of volatile organic compounds or gas diffusion physics. But they had observed, repeatedly, that this smell test predicted who would die of internal bleeding and who would not. Modern physicians reviewing this technique in a 2012 paper published in the journal Acta Chirurgica Belgica confirmed the underlying mechanism is physiologically sound. It is a low-tech, zero-equipment biomarker test for intestinal perforation, invented by people who did not have a word for bacteria. Visual note: show a clean anatomical diagram of abdominal cavity with color-highlighted diffusion pathway arrows indicating how volatile compounds travel, no surgical imagery. Fact number 4. Ancient Indian surgeons were performing nose reconstruction 2,600 years ago. Plastic surgery feels like a thoroughly modern invention, the domain of 21st century operating theaters and laser technology. It is not. The Indian physician Sushruta, who lived around 600 BCE, described a complete rhinoplasty procedure in the Sushruta Samhita, one of the foundational texts of Ayurvedic medicine, in such precise, reproducible detail that it was still being used, virtually unchanged, in India in the 1790s when British surgeons witnessed it and brought the technique back to Europe, sparking the birth of modern reconstructive surgery. The procedure Sushruta described involved cutting a flap of skin from the patient's cheek or forehead, keeping it partially attached to maintain blood supply, rotating it down over the nasal defect, and stitching it into place. He specified using 2 tubes of dried plant stems inserted into the nostrils during healing to maintain the airway and shape. He described postoperative care including wound irrigation and the application of sesame oil and turmeric paste. Turmeric, we now know, contains curcumin, a compound with clinically validated anti-inflammatory and antimicrobial properties. The British surgeons who observed this technique in India published their account in the Gentleman's Magazine in October 1794. It directly inspired the Italian and then British development of plastic surgery as a formal medical discipline. The entire modern field of reconstructive facial surgery traces a direct lineage back to a physician who lived in ancient India 26 centuries ago. Visual note: display a labeled diagram showing the forehead flap rotation concept as a simple geometric illustration, arrows and color blocks only, no clinical photography. Fact number 5. Roman army surgeons invented the hospital and had infection rates lower than 19th century wards. The Roman military hospital, known as the Valetudinarium, was not just a building where sick soldiers lay on the ground. Archaeological excavations of Roman forts along Hadrian's Wall and the Rhine frontier reveal a sophisticated architectural system deliberately engineered to prevent what Romans empirically understood as disease transmission, though they had no concept of germ theory. The buildings were designed with individual isolation rooms arranged along corridors so that patients with different conditions did not share air or surfaces. There was a consistent fresh water supply with drainage infrastructure. Roman military physicians, called medici, washed wounds with vinegar, applied honey poultices, and used turpentine resin as a sealant. Vinegar is acetic acid. It kills Staphylococcus aureus, E. coli, and Salmonella. Honey is hygroscopic and releases hydrogen peroxide, still used in wound care today. Turpentine resin contains terpenes with documented antimicrobial properties. Now here is the jaw-dropping comparison. Florence Nightingale's revolutionary work at the Scutari Hospital in 1854 focused on improving ventilation and sanitation because British military wards of the 19th century had mortality rates from post-wound infection hovering around 42%. Roman legionary hospitals, operating roughly 1,800 years earlier and using empirically derived antiseptic protocols, show skeletal trauma evidence suggesting dramatically lower infection fatality, though precise rates are debated. Roman engineers built a functionally superior infection control environment before any human being on Earth knew that microorganisms existed. Visual note: show a color-coded architectural floor plan diagram of a Roman valetudinarium with zones labeled patient isolation corridor, water supply, treatment area, clean infographic style. Fact number 6. A 1,000-year-old Anglo-Saxon eye salve destroyed modern drug-resistant bacteria. In 2015, a team of researchers at the University of Nottingham, led by Dr. Freya Harrison and medieval scholar Dr. Christina Lee, decided to do something that most scientists would have considered a waste of time. They made an exact recipe from a 10th century Anglo-Saxon medical manuscript called Bald's Leech Book. The recipe was for an eye salve to treat what the text described as a stye, an eyelid infection. The ingredients: garlic, leek or onion, wine, and ox bile salts. Each component had to be prepared in a specific sequence, combined in a brass vessel, and left to stand for 9 days before use. The researchers followed every instruction precisely, including the 9-day fermentation period in the brass container. Then they tested the finished compound against Staphylococcus aureus, specifically the MRSA strain, methicillin-resistant Staphylococcus aureus, one of the most dangerous drug-resistant bacterial threats on the planet today. The result was published in the journal Scientific Reports, and it sent shockwaves through both the microbiology and medical history communities. Bald's Leech Book eye salve killed up to 90% of MRSA bacteria in both laboratory cultures and in infected tissue models. None of the individual ingredients, when tested alone, produced anything close to that effect. It was the specific combination and the fermentation process in the brass vessel, which released copper ions with their own antimicrobial properties, that created the killing mechanism. A medieval monk recorded a formula that outperforms many modern antibiotics against one of the 21st century's most feared pathogens. The knowledge was sitting in a manuscript for 1,000 years, and nobody thought to test it. Visual note: display a side-by-side comparison chart, MRSA bacterial kill rate of Bald's salve versus common modern antiseptics, clean bar graph with color coding. Then show the original recipe as a translated text excerpt. Fact number 7. Ancient Chinese surgeons performed cataract surgery with a technique rediscovered in modern ophthalmology. Cataract surgery today involves a phacoemulsification probe that uses ultrasound to break up the clouded lens and a precision vacuum to remove the fragments through a microincision. It is extraordinarily effective. But Chinese surgeons were successfully treating cataracts approximately 2,000 years ago using a method called couching, and a refined variant of this technique, described in detail in texts like the Tang Dynasty Medical Encyclopedia Yixinjing from around 850 CE, demonstrates a level of anatomical precision that stunned historians of medicine when they reanalyzed it in the early 2000s. The Chinese procedure involved a fine, specially crafted needle inserted at the precise limbal junction, the border between the cornea and the sclera, at a specific angle, to displace the clouded lens backward into the vitreous humor of the eye, clearing the visual axis. The Tang-era texts specify the angle of insertion, the depth of penetration, and describe using the needle to gently rotate rather than rupture the lens capsule. Here is why that matters. In the 1990s, some retinal surgeons exploring minimally invasive lens management experimented with a technique called endoscopic lens displacement that operates on a nearly identical anatomical principle. Peer-reviewed retrospective analysis published in Documenta Ophthalmologica found that when couching was performed correctly by a skilled practitioner, visual outcomes were significantly better than previously assumed, with the displaced lens often remaining stable in the vitreous for years. Tang Dynasty surgeons, working by candlelight with hand-forged needles, understood the three-dimensional geometry of the human eye well enough to execute a procedure that modern surgeons would recognize as anatomically logical. Visual note: show a clean cross-section diagram of the human eye as a labeled infographic, highlighting lens position, vitreous chamber, and limbal junction with color-coded arrows showing the couching displacement path. No clinical imagery. Fact number 8. The ancient Greeks used willow bark as aspirin, but they also understood its dosing limits 2,400 years before the FDA existed. You may have heard that willow bark contains salicin, the compound that the pharmaceutical industry synthesized into acetylsalicylic acid, which we call aspirin. Bayer patented aspirin in 1899 and marketed it as a revolutionary pain and fever treatment. Hippocrates had been prescribing willow bark tea for pain and fever reduction around 400 BCE. But here is the part of this story that almost nobody talks about, and it is the most remarkable piece. The Hippocratic Corpus, the collection of medical texts attributed to Hippocrates and his school, does not just recommend willow bark. It specifies dosing. It describes giving willow bark extract to women in labor to reduce pain, but explicitly cautions against excessive dosing, noting that too much can cause stomach distress and slow the body's natural processes. Modern pharmacology has confirmed both of these exact observations. Salicylates in high doses cause gastrointestinal irritation and ulceration, one of aspirin's primary known side effects, still printed on every bottle. And high-dose salicylates can interfere with prostaglandin-mediated uterine contractions, meaning the Hippocratic warning about using it carefully in labor is pharmacologically accurate. The Greeks did not know what a prostaglandin was. They had no concept of cyclooxygenase enzyme inhibition, which is the actual mechanism by which aspirin works. But through centuries of careful clinical observation, recording outcomes, and refining dosage, they had mapped the therapeutic window of one of the most widely used drugs in human history, 2,400 years before any laboratory on Earth could explain why they were right. The ancient world did not lack intelligence. It lacked equipment. And the difference between those two things is something we are still just beginning to fully appreciate. Visual note: display a timeline infographic, horizontal axis from 400 BCE to 1899 CE, marking Hippocrates' willow bark prescription, key medieval herbal references, and Bayer's 1899 patent. Overlay a molecular diagram of salicin converting to salicylic acid. Clean, color-coded, academic style. And that is 8 facts that should make you look at ancient history completely differently. These were not primitive, superstitious people fumbling in the dark. They were empirical scientists without the vocabulary of science, observing, recording, testing, and refining over generations, in some cases solving problems that we are still wrestling with today. The MRSA killing Anglo-Saxon eye salve is currently